Hello, I hope this finds you well. Today I want us to go through introduction to MCH or maternal and child health care. Yes, and we'll first look at some of the factors that normally affect maternal and child health, especially in Kenya. We'll see these factors and also see how we can overcome these factors. So maternal and child health care in health service provided to mothers. These are the health service provided to mothers or women in the childbearing age as well as children. That's why we call it maternal and child health care. This is the care of both the mother and the children, but specifically women of childbearing age. Mothers who have already reached menopause are not in this category. We're dealing with mothers, especially mothers that are pregnant, lactating, and also planning to get pregnant. So the targets for maternal and child health care are all women in their reproductive age groups and children between the time that they are born to the time that they are in their adolescent age. So between 15 to 49 years of age, women and children, school age population, as well as adolescent. Because majority of these issues or maternal and children issues normally occur at that stage. So what are the factors that normally affect the health status of mothers? We'll start with the mothers. So mothers, especially the mother of childbearing age, the health status of those mothers are normally affected by these factors. And number one is socio-economic development. The social status or the socio-economic status of women, especially in developing countries, is really low. And this has led to a lot of serious impact on both morbidity, that is the rate of diseases, as well as the rate of death among the women of childbearing age. Another factor is poor agricultural development, and this results to inadequate household food, which has a direct impact on the nutritional status of especially the mother. So when a household do not have enough food or there is inadequate access to enough food, who is the first to be affected? We have the mothers and the children, because mothers will first feed their children before even they feed themselves. So poor agricultural production have a direct impact on the nutritional status of mothers. Another factor, maternal death often has a number of interlined causes, which may start as early as birth or in early childhood. For example, a girl who has not fed properly during her early years will be stunted and therefore more likely to have obstructed labor. Also, a woman's risk of dying from infection and hemorrhage is increased considerably when they are being malnourished. So there are some underlying issues that normally also result to maternal death. For example, if a child was malnourished from the start or from the very young age, they will live with that malnutrition, and this malnutrition may also affect them during pregnancy as well as during delivery of their children. And it's most probably that the malnutrition will be passed on to their unborn children. So maternal death can also be underlined or can also be caused by indirectly by other underlying issues. Another effect of maternal health status, or another effect of maternal status is poor sanitation, of poor environmental sanitation, poor housing, unsafe and inadequate water, adverse and social physical environment. Let's just term this as just environment. When we have poor environment in terms of physical environment, in terms of social environment, in terms of inadequate water or poor or unsafe water, when we have poor housing, when we have poor sanitation, where these women live, all this will lead to a lot of health issues. It will lead to foodborne illnesses. It will lead to waterborne illnesses. It will lead to a lot of issues that will affect these mothers directly. Another factor is access to health services. When we don't have enough hospitals, and when there is less hospitals and we don't have enough healthcare staff to take care of this woman when they are at childbearing age, when they are pregnant, when during delivery, and also after delivery, if we don't have enough health facilities and quality health facilities, definitely these mothers will be affected when they are pregnant, when they are delivering, as well as when they are postnatal, or when they need postnatal care. And remember, at that time, or those times are very, the women are normally very vulnerable to a lot of issues, to a lot of health effects, to both their themselves as well as the unborn child. So this health access to quality health services is very paramount when it comes to maternal health status. Another factor is access to education. Remember, education normally open up people to a lot of knowledge when it comes to nutrition, prevention of diseases, control on management of diseases, how to prevent someone from getting diseases like cholera, diseases like HIV and AIDS, how general hygiene is normally maintained. All this is normally opened up in a woman when they access education. When they do not have access to education, they will follow what their culture tells them to do. And remember, this majority of these cultures, especially African culture, normally exposes a lot of women, and many women, or all of the women, to a lot of issues when it comes to health, a lot of issues when it comes to giving birth, a lot of issues when it comes to family planning. So education normally opens up a woman to knowledge, and this knowledge, they will apply this knowledge to live a healthy life that is away from diseases, that is away from a lot of misconception and myths that further deteriorate their condition. So poor education of women has to be given serious consideration, because denial of education indicates that women are denied the role they can play in decision making and decrease the extent of contribution to their lives, family, and the community at large. Education is proved to have significant effect on women's health and reproductive behavior through its influence on age at marriage, contraception, and healthcare use, and awareness and risk and danger signs of some of these health issues. So women at the reproductive stage are involved or are normally vulnerable to a lot of infection when they are pregnant, or even when they are lactating. So it's really important that women are given access to adequate health, healthcare, adequate education. They are empowered in many ways in order to overcome some of these challenges. Another factor is access and control of income and resources. When you don't have access to your own income, whoever gives you your normal whoever gives you or supports you in normal and daily needs will have some more power over you, where such that you're not able to make decisions, able to make decisions for your own decisions, or even the family decisions. So when it comes to women who are not empowered economic wise, they will not be able to have any decision, to make any decision. Decision will be made by the man who is providing for this woman. And when the decisions are made by the man, they will make decisions that normally benefit them more as compared to the woman. So women income, access to household resources, and power to make decisions influences their ability to seek and utilize health services. Imagine you're being given money to go to the hospital. What happens when this person do not give you or fails to give you the money to go and visit the hospitals? You just be left behind with a lot of issues and will not seek the health services whenever you want or whenever you wish. Another factor is political commitment. Political commitment is crucial to allocate the available resources and to provide services which are accessible to those most in need. Imagine when you're dealing with a governor who is not even, do not have a heart to even support using better and quality health services, women who are seeking care, women who are pregnant, women at delivery, or the health services are just deplorable when they are just pathetic because there is no or enough resources being geared to perfecting the health status. So women will be really affected by that, and they will not be able to access the health services as it's supposed to be. So it's a political commitment or political goodwill is needed in order to empower women for them to really be able to access majority of these services, and especially the health services. Then another factor is low social status of women. Another factor is socioeconomic status of women, or social status, the social status of women, where the health and well-being of women is related to the highly influenced with their social status. So poor, powerless, pregnant, this is the status of women as labeled by a global survey in 1988. So when a woman feels poor, feels powerless, feels hopeless, that they're not able even to look for help from anyone because they're just helpless, there is no one to take care of them when they have issues. What is the effect of that? So a large number of women and girls in the world live under conditions that threaten their health, deny them a choice about childbearing, limit their education attainment, restrict their economic participation, and fail to guarantee them equal rights as compared to men. So majority of women in the whole world, and especially African culture, feel inferior, feel very as lesser human beings as compared to men. So this normally exposes them to a lot of issues because they will lead to severe burden overwork, where they have to have some conjugal function, they have some maternal function, they have some domestic function, they also have professional function. You are a mother, you are a wife, you have some, when you go home, you are supposed to cook, you're supposed to wash, you're supposed to go to work. All this is under you, and this burden will you'll feel severely burdened by all these roles that you're supposed to play, which exposes you to physical demanding activities, and these physically demanding activities normally exposes to a lot of health issues. In fact, can you imagine a mother who is pregnant, who is working, who has to look after the children at home? When they go home, they have to do homework, he have to wash them, he have to cook for them, and another thing, she's still a wife. So all this, and still she's pregnant. So all this exposes this woman to a lot of challenges later in life, and this may affect her later in life, and that's why you see a lot of women normally start to have issues when they are at the old age because of the burden they were at during the early ages. So although all factors in the framework are likely to influence maternal morbidity and mortality as well as the health of women, some have greater impact in the short term, particularly on the incidence of maternal death. So you'll find mothers either dying at early ages or having effects or having challenges when they become old. And this is because they are overburdened because of this social status where the culture has really put the woman in a status that she feels very inferior and have to please men and have to please men in many ways. When they are raped, when they are done anything the woman want to do to them, they have no anywhere to go and seek for help. So this exposes them to a lot of challenges, both psychological, both social, as well as physical well-being of these women. Then I want us to go to another subtopic. Still, we are into introduction, that is maternal mortality. And this is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the site and duration of pregnancy, from any acutely related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So this is the death of women who are either pregnant or within 42 days after termination of pregnancy, irrespective of the duration of pregnancy. For example, maybe there was a miscarriage at 6 months. So still the 42 days will come after the 6 months. So from any acute disease or issues related to pregnancy. For example, if a mother dies of malaria, that is maternal mortality. If the mother who is pregnant dies of malaria, if a mother who is pregnant dies from another infection or infection related to pregnancy, that is maternal mortality. But remember, this maternal mortality is not caused by either accident or either maybe being killed. It can be either accident or being killed. That is not maternal mortality. But maternal mortality will occur when we have diseases or infection related to pregnancies in mothers who are pregnant, irrespective whether they're 2 weeks pregnant, 3 weeks pregnant, or within 42 days after termination of a pregnancy. What are the major causes of maternal mortality? We have hemorrhage, we have infection, we have hypertensive disorders of pregnancy, we have obstructed labor or prolonged labor, we have abortion. So we'll go one by one and see what is all about this. So we'll start with, so the first issue or the first infection that I want us to, not infection, the first challenge or problem that is normally faced by pregnant women is hemorrhage. So it can occur during pregnancy, delivery, or postpartum period. So bleeding can either occur during pregnancy, it can occur during over excessive bleeding during delivery, as well as postpartum period. During pregnancy, it can occur at the following stages. During the first trimester, and this can be caused by abortion. The second trimester, and this can be caused by placental location, the placenta trying to relocate, and preterm labor that is occurring before its time. So the third time is third trimester due to abnormal placental location. If the placenta is not located at the location that is supposed to be, then you can have hemorrhages or even premature separation of placenta from its attachment and premature labor. So this can be the causes or the stages at which hemorrhage can occur. It can occur during the 3 trimesters. And during those trimesters or during those different stages of pregnancy, the bleeding is caused by various causes. Another challenge or another problem that occur, health problem that occur, is infection. And infection is prevalent among the disadvantaged, and risk increases by factors like anemia, malaria, goiter, and malnutrition. Who is among the people that are normally disadvantaged? These are people that are at marginalized areas, underdeveloped areas where we don't have enough food, we don't have enough health facilities. We don't have enough health staff that we need in order to prevent these mothers from a lot of this infection. But these infections, or the risk to get this infection, is highly increased in pregnant women who have anemia, in pregnant women who have malaria, in pregnant women who are suffering from goiter, as well as malnutrition. Maternal infection is a serious problem as a result of vicious cycle caused by low caloric intake, heavy workload, and infection. So the other one will lead to the other. Infection will cause low caloric intake. Low caloric intake will cause infection. Heavy workload will cause infection, as well as it normally occurs like in a vicious cycle, like in a cycle. So it is also compounded by pregnancies at young age and too many pregnancies too close together. So still infection can be associated to many pregnancies, or having many pregnancies that are close together, and also the young age pregnancies can also be associated with infection. Then poverty also perpetuates the problem through illiteracy, poor sanitation, inadequate housing, that is, we have a lot of people living in one house, and inadequate and unsafe water. So poverty can also be associated with this infection, or to be a cause of infection, because, and this is indirectly, because if we are illiterate, we don't have knowledge on what kind of infection normally caused by, or the sources of infection, or the risk factors to infection. There is poor sanitation due to poverty. There is inadequate housing, where people are overcrowded, where infection or communicable infections can be transmitted from one person to the other very easily, and where there is inadequate and unsafe water. So all this can be associated with infection. So infection can be caused by low caloric intake, can be caused by heavy workload, can be caused by early pregnancies or young age pregnancies, can be caused by a lot of pregnancies that are close together, can also be caused by poverty indirectly. And this is highly increased, or the risk factors are highly increased due to factors such as anemia, malaria, goiter, and malnutrition. Another problem is obstructed labor or prolonged labor. And obstructed labor occurs when there is no advance of the presenting part despite good uterine contraction. There is no enough space for this child to pass through, even if you have good uterine contraction. It can be cervical region, or maybe the cervix is not able to open well for the child to be delivered normally. Then teenage pregnancy is a serious risk factor and mostly occurs in the first delivery. Obstructed labor normally occurs either in teenage pregnancy or during the first child, or during the first delivery. So between 1 and 13% of pregnant women suffer prolonged labor. So as you can see, we have a lot of women suffering through prolonged labor. And though the level of obstructed labor varies from country to country, obstructed labor can result not only in maternal death, not only can the mother die, but also the unborn child, that the fetus can also die due to infection, due to birth injury, or lack of air, or lack of breathing, which is asphyxia. So infection can occur during obstructed labor, birth injury can also occur during the obstructed labor, and asphyxia or inadequate breathing during delivery. Another problem that occur during pregnancy is hypertensive disorders of pregnancy, also referred to as toxemia of pregnancy. And this includes eclampsia and pre-eclampsia, which are occurring only during pregnancy after 20 weeks gestation as a result of pregnancy-induced hypertension. It will occur around 4 months to 5 months during pregnancy, and it can occur in two ways. We have eclampsia and preeclampsia. We are going to see the difference between these two. So early stage preeclampsia is characterized by high blood pressure, generalized edema, and excess protein in the urine. So edema or swelling of legs, which is very characteristic of pregnant women, can also be a sign of a danger. So it's not that necessary, or it's not good to just ignore because you saw someone else having edema and you're having edema when you're pregnant. It can also be a sign or a danger sign of preeclampsia. Then you have high blood pressure. That's why each and every pregnant woman during clinics, they have to be taken their blood pressure. Then we have excess protein in the urine, can also be a characteristic of preeclampsia or a sign or a symptom of preeclampsia. Then it may arise in the second or third trimester. Eclampsia is characterized by, so preeclampsia is characterized by high blood pressure, generalized edema, and excess protein in the urine. When it comes to eclampsia, is characterized by high blood pressure, convulsions, and possible cerebral hemorrhage. As you're going to see, preeclampsia normally leads to eclampsia, and this eclampsia can even occur even after delivery. So this preeclampsia, if not taken care of, can lead to eclampsia, which is a very dangerous risk or a dangerous disease during pregnancy, because we have a lot of high blood pressure, very high blood pressure, convulsions, as well as it can lead to brain hemorrhage, where your brain starts to bleed, which is a very risky disease. So untreated preeclampsia leads to eclampsia in less than 1% of pregnant women. But the condition is serious and the outcome poor. So the condition is a very serious condition. So immediate transfer and treatment, including expedited delivery, are required. So between 5 to 17% of eclampsia victims die, and those between 5 to 17% will die, and those who survive may suffer paralysis, blindness, or chronic hypertension and kidney damage. So that's why I'm saying it's a very serious condition to ignore when pregnant. So pregnant women really need to be checked high blood pressure now and then in order to overcome this progression of preeclampsia to eclampsia, which can lead to this adverse effect to the mother. So eclampsia can happen at any time during the latter part of pregnancy, and it can and often does result in fetal death or the birth of a premature infant at high risk of death. So eclampsia is not a joke. So hypertension and preeclampsia can also result in low birth weight and infant or fetal death. The detection and management of hypertensive disorder of pregnancy depend on continuum of services from prenatal care through routine and emergency care around the time around the time of the delivery. So it's really important that those who are pregnant and have these hypertensive disorders always and continuously follow what the doctor says. If the doctor says come after 2 weeks, come after 1 week, come after 1 day, it's supposed to be there's supposed to be a continued service. There's supposed to be a presence of services or a lot of care during the last time of the pregnancy. So much of the reduction in fatalities in industrialized country may be attributed to improved medical support. That's why I'm saying this mother needs a lot of medical support for the critically ill patient, and the increased use, effectiveness, and safety of methods of expediting delivery, including induction of labor and operative delivery. So in developed countries, you'll find rarely this eclampsia bringing about poor or bad effects later, because there is a lot of medical support from the medics to the mother, and also the mothers are able to go and access these health facilities. They are educated on the benefits of continuum, visiting the doctor, and adhering to what the doctor says. So it's really important that pregnant women being supported, have medical support for critically ill, especially those critically ill, and that there is increased use of an effectiveness and safety of methods of delivery. So you'll find mothers in our villages opting to be helped by a midwife in the village as opposed to going to the hospitals. And that's when you'll find a lot of adverse effects happening to these mothers together with their unborn child, because there is no safe methods being used during the delivery. So it's really important that mothers, especially in the marginalized areas, be educated on the importance of going to a specialized staff for delivery. So the most basic requirement for adequate attention to hypertension in pregnancy is blood pressure monitoring by trained personnel during prenatal care. So it's really important that pregnant women be medically supported by a trained personnel, because a trained personnel will know when there is abnormality in pregnancy, as compared to that person who is not trained just because they saw someone trying to deliver someone and we think that it can also help this person to deliver. Another problem is abortion. And general consideration, abortion is termination of pregnancy before the fetus is capable of extrauterine life. So abortion is the termination of pregnancy before its term, and it depends, depending on the cause of abortion, they're normally classified, or abortion can be classified into these three ways. Number one is spontaneous abortion, commonly known as miscarriage. This is unprovoked termination of pregnancy. It just happened. That's why we are saying it's spontaneous. Then number two is induced abortion due to deliberate interferences. So this pregnancy was very good, did not have any issue, and this abortion was not spontaneous. It's something that one decided to remove the pregnancy. And this can be due to, number one, in accordance with legal sanction. Maybe you're forced to abort a child because of one factor to the other. Then we have outside of the law. Then we have abortions when maybe a person do not want that pregnancy. For the first one, it can be due to legal issues. It can be due to legal causes. But the second one is just someone not accepting the pregnancy and then terminating the pregnancy on their own wish. Then number three is the therapeutic abortion, which is performed exclusively for medical reasons, especially when, number one, there is danger to the mother health is high if pregnancy continues. If pregnancy, if the mother's health is really at risk, if this pregnancy continues, then the patient together with the doctor might opt to remove or to terminate the pregnancy. Then still under therapeutic, if fetus is threatened with congenital and genetic abnormality, induced abortion is one of the leading public health problems in all regions. So this is another sentence, sorry. So if the fetus is threatened to get abnormalities that may expose them to a lot of health effects later in life, you can opt to abort that individual, because you this is also therapeutic because the fetus might be threatened later in life. because of these genetic abnormalities as well as congenital abnormalities. Induced abortion, this abortion that is due to maybe someone do not want the pregnancy and goes to the court and get legal sanctions. Another one, if that person do not want pregnancy and want to terminate the pregnant on their own wish, is the leading cause of abortion. So abortion does not just merely mean that as you can see, abortion can be as a result of many factors. So it can be either voluntary, spontaneous, or even therapeutic. Then we have unsafe abortion. So what is an unsafe abortion? A pregnancy terminated by untrained and unskilled person is unsafe abortion. It increases the risk of death 250 times, as its complication is a major direct cause of death among women in reproductive age. Majority of women who die due to abortion is normally as a result of unsafe abortions. When you're just practicing or you're terminating the pregnancy without the help of a skilled personnel. So whatever the type of abortion, either spontaneous or induced abortion, the events and the care received determine whether the abortion is safe or unsafe. Even though spontaneous abortion can occur in 10 to 15 times, 15% of known or suspected pregnancies, it is less fatal than unsafe induced abortion. Spontaneous is less safer as compared to induced. Remember, induced, the pregnancy was intact. So you're forcing the pregnancy to be terminated. But for the spontaneous, it's just due to maybe other factors caused the pregnancy was terminated because of other factors. But as for the induced one, the pregnancy was intact. That's why the induced pregnancy or termination of this induced abortion, which is not handled by a skilled personnel, puts this individual at high risk of dying. What are the factors that normally leads to unsafe abortion? Number one is demographic risk factors. And age is an important determinant whether pregnancy is unwanted and therefore aborted for choice of abortion, and extent of the resulting clinical manifestation. So demographic characteristics, number one is age, where abortion is highly practiced by the young age, school girls who are unmarried, who are students, or even dropouts, usually as a result of ignorance, lack of knowledge, due to fear. They're ignorant. They don't know that this induced abortion can cause death. They don't know that this induced abortion can cause infections. They don't know what would happen to them if they tried to do this induced abortion. Then another reason is fear. The fear that when I give birth, my mother will kill me. When I give birth, that my society will reject me. So this that lead to denying the pregnancy symptoms until they become unmistakable. As a result, pregnancy advances and leads to complicated abortion. So still these women, because of ignorance, because of fear, because they don't want this pregnancy, or they're denying that they're pregnant, this pregnant will grow and grow. And the more the pregnancy progresses, the more the risk of dying when there is an induced abortion. Another cause is contraceptive failure or lack of access to family planning, where socioeconomic and cultural risk factors, where women seek abortion when pregnancy occurs in circumstances such as severe hardship, insufficient income, or intense socioeconomic deprivation. Contraceptive failure, which may lead to people getting pregnancy. This pregnancy, due to socioeconomic and cultural risk factors where these women lives, these women may seek to abort this child because the socioeconomic status is very low, as well as the culture does not maybe prohibit this woman from getting pregnant. Then we have another factor, culture and religion, myths, taboo, which prevents using contraception or value fertility. So you'll find many cultures prohibiting people from accessing family planning. You'll find some religion or some religious practices prohibiting the use of family planning. You'll find even some religious religion prohibiting people from going to hospitals. So if they don't go to the hospital, definitely they'll not also be able to use contraception or contraceptives. So many cultures in Africa disapprove contraception for single and unmarried women. Majority of our African culture will prohibit sex, and prohibiting sex, definitely they prohibit people from getting access to what? Contraceptives, if they're not married, and especially unmarried women. So lonely women such as widows, separate or expected to remain, they are normally expected to remain or to abstain, and pregnancy is regarded as a major violation of the traditional norms. So what would happen if a woman is widow and they become pregnant? They will definitely abort this child because the culture will prohibit them from getting getting involved in sexual conduct, because just merely they are engaged in marital sex. So due to this, you'll find majority of these women who have separated, who are widows, aborting these children. And because it's something that they do when they in secret, definitely you'll find unskilled personnel being the one helping them to abort. And due to that, they will lead to a lot of issues that may affect them later in life, if not right now. So as you can see, unsafe abortion can be brought about by a lot of these demographic factors. It can be age, it can be the status of this woman, whether married or unmarried. It can also be due to socioeconomic factors, due to contraceptive failure, due to religion, or even culture, myths and taboos that normally governs a certain society or a certain culture. What are the other causes of maternal death? We also have direct obstetric, and these are deaths that results from obstetric complication of pregnancy, labor, and puerperium forum, where interventions from omissions and incorrect treatment, or from chain of events when pregnant or during the first 42 days after delivery. So these pregnancy complications that might occur during pregnancy, during labor, during after delivery, and they are caused also by incorrect treatment of some of the infection that these individuals might happen to contract when they're either pregnant or after pregnancy. So examples, we have abortion, we have ectopic pregnancy, we have preeclampsia, we have eclampsia, we have obstructed labor, infection, and anesthesia. So anesthesia, as you can see here, is a treatment intervention that normally occur during delivery. So if this treatment intervention that is normally used during delivery, it can be maybe during the cesarean section, when that individual is undergoing through cesarean section. If this anesthesia is not used as it's supposed to be, it can lead to a lot of complications after delivery. So that's why I'm saying direct obstetric, it can be brought about by issues during pregnancy, after pregnancy, during labor, and also it can also be as a result of the interventions that are normally used during delivery, especially during labor time or during delivery. They can cause a lot of issues. So these are the issue or the direct obstetric issues or complications I'm talking about. So we have hemorrhage here. We've already covered hemorrhage, which can occur before pregnancy, after pregnancy, during abortion, during delivery. It can also be caused by ectopic pregnancy. Then number 2 is unsafe abortion. It is the commonest cause of maternal death. Hypertensive diseases, we've already covered eclampsia and preeclampsia. We have obstructed labor, which is prolonged labor, which can cause uterus to rupture. Then the 5th cause of death is infection, and the introduction and multiplication of microbial agents in the pelvic organs and other systems, having an effect on the health of the mother and the newborn. So if the infection occurs in the pelvic region, where we have the uterus, we have the oviduct, we have the ovaries, when they are infected, it's a high risk infection because it may affect both the mother fertility. It can also affect the newborn because the infection will definitely spread to the unborn child. So it includes infection of the uterus, tubes, urinary system, as well as fetal infection. Then we have another indirect obstetric death, and these are deaths resulting from previously existing diseases or diseases that develop during pregnancy, which were aggravated by physiological effects of pregnancy. These were diseases that occurred, that were present before the woman became pregnant, and they were existing even during pregnancy. And due to the physical status of this individual, or due to the presence of pregnancy, they were made worse. And this includes anemia. And this is the commonest direct cause of maternal death in our country. Since malaria is endemic and iron supplementation is low, you'll find mothers being given iron supplement and never using them. So when you have anemia, it's a high also a cause of death. So it's really important that pregnant women take iron supplement. They also use the net that they normally given during clinics. It's really important that they prevent themselves from getting anemia. So other indirect causes of death include heart diseases, include diabetes mellitus, it includes HIV and AIDS, if the woman had TB, if the woman had malnutrition, if the woman had diabetes, if this woman had some heart diseases such as hypertension and the like, these cardiovascular diseases, this may aggravate the risk of death. Then maternal mortality can be viewed in the context of 3. Maternal mortality can be caused by delays in deciding to seek care, in accessing the care, and also in receiving the care. So delays can kill mothers and newborns. There are 3 phases during which delays can contribute to the death of the pregnant woman and postpartum woman and their newborns. Number 1 is delay in deciding to seek care. And this may be as a result of failure to recognize signs of complications. You're pregnant, but you don't know whether you have some complications. Failure to perceive severity of illnesses, you just ignoring these signs and symptoms. Cost consideration, you're feeling that you don't want to go to hospital because you don't want to pay. Previous negative experience with the health system, you might feel that I don't want to go to the hospital because maybe in my first pregnancy the health workers were very rude. Maybe I lost my first pregnancy when I was in the hospital, so I would opt to stay at home because I don't want to go to the hospital because I believe maybe the hospital is the cause of my losing my pregnancy. We also have transportation. You're considering, it is very far away from where I am. I don't want to go because the health facility is very far away from where I am. So this can delay you from seeking care. Then the second type of delay is delay in reaching care, where you have lengthy distance to the health facility and maybe you're using foot or you're using a vehicle and the health facility is very far away. You're using maybe a bicycle and the health facility is very far away. Conditions of the road, if the condition of the road is very poor, it is rainy seasons and the roads are very poor, you might also take time before you reach the hospitals. Then there is lack of available transportation. When we don't have roads, we don't have vehicles that can carry you. We don't have even motorcycles to carry you. So this can also delay you from reaching the care. Then number 3 is delay in receiving appropriate care. And this is a very and major problem that normally affect majority of our county hospitals, where there is uncaring attitude of the nurses and caring attitude of especially the nurses. They have that attitude of not caring. So you'll find a person going to the hospital and staying for a very long time in the queue because maybe the nurses are very busy doing something else, or even the doctors are not caring to even take care of the very critically ill patient. Then number 2 is shortages of supplies and basic equipment. If we don't have enough supplies in terms of drugs, in terms of equipment to help you during the, this can also delay in receiving appropriate care because maybe you're sharing one medical or one labor ward is sharing with another labor ward. So this may cause a lot of just take an example of a hospital that maybe have 2 labor wards and the equipment they're using in this labor ward is or they don't have enough equipment to be used in both the labor wards. So one labor ward will wait until the other labor ward finishes with the equipment. So this leads to shortages of supplies, or this leads to delay of receiving the appropriate care. Even if you reach the hospital at the right time, you might be delayed in receiving care. We also have non-availability of health personnel in majority of our county hospitals. We don't have enough doctors, we don't have enough midwives to help these individuals, we don't have enough personnel to take care of these individuals. Then you have poor skills of health providers. If the health providers do not have adequate skills in order to prevent these mothers from getting more and more infection or even treating these individuals well, definitely they'll have severe issues later in life. What is maternal morbidity? Maternal morbidity is the rate at which mothers, when they're pregnant or even 42 days after pregnancy, get diseases. So maternal morbidity can be caused by, maternal morbidity is difficult to measure due to variation in the definition and criteria to diagnose. The risk factors for maternal morbidity includes, we have prolonged labor, we have hemorrhages, we have infection, we have preeclampsia, etc. The most common long-term complication of pregnancy and childbirth include the following. So causes of maternal morbidity is really tricky to find, but there are some risk factors that have been identified to cause this morbidity. And these risk factors includes infection, includes fistula, includes uterine prolapse, includes infertility, so includes damage, nerve damage. Number 1 is infection. When there is a high risk of infection of the genital organs, we have cervix, we have uterus, we have tubes, we have ovaries, and peritoneum after prolonged labor. So prolonged labor can cause a lot of these infections. Number 2 is fistula. Prolonged also labor can cause holes in the birth canal that allows leakages of urethra from the bladder or rectum into the vagina. So you'll find the vagina, some feces coming through the vagina, or some even urine going to the rectum. So women present with continuous leakage of urine or feces, or both. The commonest cause of this fistula in our country is obstructed labor or prolonged labor, as opposed to surgery and cancer in the developed world. In the developed world, you'll find this fistula can be caused by surgery and cancer. But for our country, majority of women that normally suffer from fistula is through prolonged labor. Then number 3, is uterine prolapse, and this is the falling or sliding of the uterus from its normal position into the vaginal canal. So the uterus is not in its own position. It have relocated and now just want to come out through the vagina. So commonest predisposing factor include prolonged labor, heavy exercises, and multiple childbirth. And unfortunately, in our Kenyan or in our African countries, those 4 are the major things that women of reproductive age are exposed to. You have majority of them due to poor condition of the health facility, or if inadequate access to health facility, they undergo prolonged labor. They are overworked even before they get healed or they regain their normal status after delivery. They're already going to their farms to look for food for their children or for their family, because majority of the men are very responsible. We also have majority of them giving a lot of births. So all these have led to a lot of uterine prolapse in pregnant women, in majority of our childbearing age women. Another factor is infertility, and this is inability to become pregnant for a year despite unprotected sexual intercourse. This is also a morbidity that is affecting majority of our childbearing age women. Another one is nerve damage, and this is as a result of prolonged labor. There may be compression or damage of the nerves in the pelvis and may result in foot drop and contractions, psychological problems such as anxiety, depression, and psychosexual problems, and others include pain during intercourse, low back pain, anemia, etc. So nerve damage is the damage of nerve that normally passes signal to all the parts of the body. And a major cause of morbidity, of this type of morbidity, is as a result of prolonged labor too, where the nerve that are normally very affected is the nerve that normally surround the hip region. So if these nerves, they're also called sciatic nerves, this may result to the legs not be able to function well, psychological problems, this nerve damage can cause a lot of issues to this mother. It can cause even pain during sexual intercourse, low back pain now and then, anemia, and many other infections. So I hope this slide or this video recording will help you understand more about both the maternal mortality as well as morbidity that are normally experienced by mothers during pregnancy, during delivery, or even after delivery, that is 42 days after delivery. So all the best as you go through this video, and keep it safe.